Hey y'all, I'm Dr. Marcy Crouch. I'm a pelvic floor physical therapist, also known as the Down There Doc. And today we're talking all about diastasis recti after having a baby. We're going to talk about how to self-check, what to do about it, and what to keep in mind as you recover with diastasis. Many changes happen to your tummy after having a baby. And I think it's really important to note that there's a lot of these terms floating around, like mummy tummy, the mom pooch, fupa, all of these like horrible terms that just make me want to vomit in my hat. The thing to remember is that there's no such thing as like a perfect mom bod, right? Other than you are a mom and you have a body. So therefore, you have a mom bod. There are three main changes that you'll see in your abdomen or your tummy after having a baby. One is going to be something called diastasis, which is a very common term and something that's actually normal in pregnancy. And we'll talk a little bit about that in a second. The second would be loose skin. Skin is amazing and it stretches to accommodate the growing baby in the uterus. So sometimes we notice after the baby has come out and we're postpartum that we have a little bit more kind of looseness in that area, and it's just skin. And then the third thing are stretch marks, and stretch marks are genetic. Whether you get them or whether you don't isn't only a factor of like how big the baby is or where the baby is carrying. It's all genetic and how your collagen responds to load. Let's talk about diastasis. This is the most common, and in fact, it's actually normal during pregnancy, and we'll talk about that in just a minute. And as a pelvic floor physical therapist, this is really something that we can impact and change. So I want to make sure that everybody kind of understands what diastasis is and what to do about it. So first, let's just define it. Diastasis is separation. That's the definition of the word. And it's where your six-pack abs, your rectus abdominis, basically have to move out of the way to accommodate the growing baby and growing uterus. Okay, this is normal during pregnancy. The problem that we see is when it persists into postpartum and it affects how the abdominal wall is functioning and how those abdominal muscles are able to contract and work with the pelvic floor muscles. And a diastasis isn't a tear in the muscle, and it's not a hernia. It's just this widening of the gap in between the two muscles. And that really changes the way that we manage pressure in our abdomen. It changes the way that we move. It changes the way that we lift. It can contribute to incontinence and back pain. And I think we really need to understand that this is a musculoskeletal dysfunction, and we can heal the diastasis and rehab the diastasis after baby to make sure that the entire trunk and system is working properly, so we don't have leaking, we have good strength in our abdominal wall, we know how to lift and move properly so we don't injure ourselves, and if this is your first baby, that we're ready and prepared to carry second or third babies if you want to continue to grow your family. And when I say it's common, I mean that 60% of moms have diastasis at 6 weeks postpartum, and at 12 months postpartum, 32.6% of moms still experience it. So again, even though it's common, doesn't mean that it's normal, and there are things that we can do. One of the most common questions that I get from mamas is how to even tell if you have a diastasis. So let me break it down for you. You might have noticed during your pregnancy, especially towards the end of the pregnancy, that when you went to get up from sitting down or get up from laying down in the bed, you might notice like a doming or a triangle coming out of your abdominal wall. And that's from a diastasis if you have one, because we have this separation now in between the two bellies of the muscle. And as we contract those muscles to lift us up out of bed, we might notice kind of that space, that excess space now coming together with that increase in pressure. So that's one way to tell. You might just notice that coning or doming. But a good way to check postpartum, because remember, it is normal during pregnancy, is by doing a simple curl up exercise on the floor. You'll do almost a mini sit-up. So this is kind of like a baby curl. You'll lay down on the ground, feet flat, knees bent. You're going to put one hand behind your head, and you're going to put one hand or two fingers right around your belly button. And what you want to feel for is the sides of each muscle. Keeping your fingers there, that's when you do your little mini curl up. So you're just lifting your head and your shoulders off the floor a little bit to activate those muscles. And what you'll feel if you have a diastasis is a separation in between those two muscle bellies. And it's usually more prominent right around your belly button. That's kind of the best way to do a self-check at home. In the clinic, we have different tools to measure, like ultrasound or tape measure, but that's kind of the best, quickest way to do it on your own. But if you're not sure and you still need a little bit more guidance, I 100% recommend all moms connect with a pelvic floor PT to really make sure that you're getting a good assessment. If you have a diastasis, what do we do about it? First thing I'm going to say, don't Google at 3 a.m. in the morning. It is not helpful. There is so much information out there on diastasis. Some of it is good, most of it not super helpful. It can be very confusing, and a lot of it is based on fear. Here's what I like to start with and what you can easily do at home. First is to get into some really good compression. And I'm not talking about those belly binders that are like corsets. A lot of people think that those will just magically close the diastasis. And in fact, they're worse for your abdomen and worse for your pelvic floor. The type of compression that you want to get into is a graded compression upwards. Okay. So think about like leggings or postpartum recovery garments or anything that has kind of a upward graded, gentle squeeze of your abdomen that comes all the way up to kind of the bottom of your breastbone. Think about the whole area where the baby used to be is what you want to be supported. Second thing that I teach all my mamas with a diastasis is how to turn on and activate what I call the foundation. And this is a combination of your pelvic floor muscles, your deep abdominals, your diaphragm, and the position of your ribs. When we start to think about our core after having a baby, and yes, diastasis affects how the core is moving, we have to think about all of these parts. It's not just one muscle. It's not just one tummy muscle. It's not just one pelvic floor muscle. It's everything working together. So in order to make sure that the entire abdominal wall and trunk is working the way that it should, we need to make sure that all of those different pieces come on at the right times. So when we start to activate our pelvic floor and activate our abdominal muscles, that's really when we can start to build on that and progress to more exercise. So the foundation really is a combination of a pelvic floor contraction, so lifting up and in of your pelvic floor muscles like you're trying to stop gas or hold in urine, an exhale, a drawing in of your lower abdominals and attacking down of your ribs. You want everything to kind of be towards the belly button and supported as opposed to being kind of extended and lengthened out. Once we get the foundation activated and working the way that it should, then we progress into what I call the basic three. And this is a combination of three main exercises that's appropriate for everyone that has diastasis when we're starting out in our rehab journey. And this is a combination of march, where you're laying down on the ground, so we call them supine marches, a bridge that's specific to the pelvic floor and the core, and what we call a heel slide. This is a combination of exercises that targets different parts of the abdominal wall and the pelvic floor. We go more into depth with this in our program, and I show you how to make it harder or easier if needed. But these basic three exercises need to be in place first to support the diastasis and your pelvic floor in order to continue down the road of recovery and exercise. So what do you need to keep in mind if you have a diastasis and you need to heal from it? I think the first thing is to realize that you can have a very strong and a very functional core and pelvic floor with a small diastasis. Okay, so if you look at anything that says like, close the gap all the way, totally heal from diastasis, only have surgery, you might want to kind of backpedal a little bit because that's not totally accurate in terms of rehab and recovery. Think about making sure that you're able to contract your foundation, hold pressure in your abdomen, do these functional activities, exercise the way that you want to exercise, and have an overall kind of health and wellness outlook to this. All right. Even our profession, this has changed in the last couple of years. We used to be very concerned with how big the diastasis is, but now we don't really care so much about the size of the gap. We care more about the overall picture of function, how your abdominal wall is working with your pelvic floor, what's the tension like in that separation, and are you able to keep that when you progress up the levels of exercise? So remember, it's not just about losing the baby weight, right? The focus should be on overall health and recovery, comprehensive support, function. Doing these higher level things with the diastasis is normal. We just have to manage it differently. Okay, so we're changing the narrative here from bouncing back and getting your body back after baby to bouncing forward with strength, joy, confidence, compassion, and grace for ourselves, because we just did something amazing having this baby. So remember, you can be strong and functional even if you have a diastasis. The most important thing is that you know where to go, you know how to manage it, and you're not afraid to move. Okay, mamas, I hope that was helpful. If you're loving this and you're like, I need more support for my diastasis, I would love to invite you to join us in our community and our courses Down There, Done Right. This is an amazing community of mamas, and this course was designed for moms just like you to help you bounce forward, not backwards after having a baby. So it's awesome if you're pregnant now, if you're recently postpartum, if you're 5, 10 years postpartum, doesn't matter. If you have any sort of symptom, leaking pee, feeling unsure of what exercises you should or should be doing, pain with sex, heaviness in your pelvis, just feeling like you're not quite sure how to move, this is the course for you. So hit the link, join us, and I'd love to see you in the community.